Here. In no particular order, I think we'll just have the white coats next to the secretary.
That's the most important thing.
In the middle.
So you said who is all going to speak? Who wants to speak?
So all the principals are going to speak, but only you will take reporter questions.
Okay, okay. So Bancel.
Martha, you should come in the middle.
You should be ready.
Thank you.
Okay, do we have everybody who's going to speak?
We do, and if you guys just want to get a little closer, and then Secretary, you'll pick it up and then just popcorn it.
Okay.
And then once we're done with remarks, we'll start Q&A with you.
Okay, so let me be sure everyone is ready. And give me a thumbs down if you're not ready. Otherwise, I'm going to start.
Okay, I think that's a yes.
Okay, so let me tell you who's going to be speaking. So I will kick it off, and if you all will give me the courtesy of allowing Dr. Morris to speak after me, since this is her place. She is the pharmacist here. She was the one who was gracious enough to administer the shots. I say shots, not shots. We got COVID and flu shots today. And Mr. Brewster, where's Mr. Brewster? Mr. Brewster, you can get in here too. He actually was asking about the RSV shot as well. So stay tuned, because we want to make sure that everyone in America understands that it's important not just to get the COVID shot, not just to get the flu shot, but RSV as well. For many Americans, if you're 60 or over, and some of our very young children, RSV can be very dangerous. So we want everyone to understand that this is all very important. But I will ask Dr. Morris to say some words, English and Spanish, by the way, for her.
Okay.
In both, a little bit in both.
That's fine.
It always helps in Spanish as
I
well,
know.
if you can. Yo también puedo decir unas cuantas cosas en español después. After Dr. Morris, I'm going to ask the two gentlemen who made it possible for this shot to be available, their teams. I'm going to ask Dr. Borla, Albert Borla from Pfizer, who is the CEO of Pfizer, who is here and who got his shots today, to say some words. And then Mr. Stefan Bancel, who is the CEO of Moderna, who is here with us, who got his shots earlier and is already vaccinated, to say some words. Pfizer, Moderna, Pfizer, those vaccines work. And they're now available to Americans in their most updated version, so that you can have the greatest protection possible to avoid having COVID impact your life and that of your loved ones. And so we're thrilled that they took the time to be here. And we are here at CVS Pharmacy, which I think Americans around the country understand has been one of the best places to be able to get your COVID vaccine, your flu vaccine, without cost. For free, but better to say without cost to you out of pocket, because it's not free. People are paying to make it possible for you to not have to put a penny out of your pocket to get this vaccine. I will ask after Mr. Bancel to have Mr. Shaw, Prem Shaw, who is the Executive Vice President for CVS, say some words. Then after Mr. Shaw, I'm going to ask Dr. Joné Khaldoun to say some words. Dr. Khaldoun is the Chief Equity Officer at CVS. And then the most important person here who can say some words, and that is Mr. David Brewster, who is someone who, yes sir, who is just someone taking the best steps to protect himself and his family. His wife was going to come, but she's going to get her shots later. And Mr. Brewster could tell you how many times he's actually been vaccinated for COVID and what he's doing to make sure he's safe. He also give my mother a big hug. Phenomenal things for this country and for me and my family, and we owe that back to her. So when we celebrate her birthday, we're doing everything we can to make sure it's as safe as possible. And I thank all the women and men at Pfizer and Moderna vaccine. And Stefan, thank you so much for everything you are doing to make this work. We've now
I'm original from Peru. I've been here for more than 18 years, and I always do my career pharmacist. And I'm very happy to work for CVS in announcing that we have the Moderna and Pfizer available, along with the flu shot. So everybody is welcome in. Appointment is recommended, but walking is also allowed. So thank you so much for coming here, and we encourage everybody to get their vaccinations today. Thank you. Thank you.
Hello, everyone. First, I want to thank Secretary Becerra and the administration for inviting here all of us today. It's hard to believe that it's only 3 years since the world was in fear. People were dying, businesses were closing, and in the middle of all this darkness, people were hoping for a light at the end of the tunnel. And that was the light that they were expecting to feel safe for their families. They were expecting this light to be able to reunite grandchildren with the grandparents and hug them. And it was a light that will allow them to open their businesses, see their customers, mingle with their co-workers. And this light came, and came faster than anybody thought, and it came from this place, from this country, for the entire world. Because it was in America that scientists developed the solutions for the prevention and for the treatment of COVID that eventually gave life back to all of us, make us all feel human again. And there is something magic about this land. It is the entrepreneurial spirit, it is the constant pursuit of scientific breakthroughs and technology, it is the American dream culture that nothing is impossible, that allows scientists in this country, irrelevant if they are born here or not, when they work here, to do things that in no other place can happen. So this day, which is a symbolic day, I think, for us, that we all took our shots, my thoughts and hearts are with those that we lost during this pandemic, and unfortunately, each one of us has many beloved among them. And my gratitude goes to the scientists and manufacturing workers that work relentlessly to make sure that we are all safe and we can all go back with our lives again. Thank you very much.
Thank you, Secretary. Good morning, everybody. Thank you so much for having us today. As Albert said, I think it's a very important day because we have the tools today to protect our loved ones and to protect ourselves. We have all lost people and friends during the COVID pandemic, and still, according to the CDC, 20,000 people in this country got hospitalized last week. But we have the tools. Thanks to the work of scientists, thanks to the work of government, we have the tools to be able to protect each other, to protect ourselves. So my plea to all of you is to protect yourself, but also, if you get vaccinated, protect your loved ones. My wife went through a pretty significant surgery recently. As soon as the flu shot was available a few weeks ago, I rushed to my CVS to get my flu shot. So if I got flu infection, I would not give it to my wife. And as soon as the FDA approved the updated COVID boosters, I also got my booster to protect her. So protect your loved ones, like the Secretary wants to make sure his family protect, his mother. It's really important. If we all take care of each other, this country will be very strong. Thank you very much.
Thank you, Secretary Becerra. Thank you, Dr. Burla and Mr. Mansell for being here. And we're at our CVS in the Navy Yard in Washington, D.C. And as I think about our role that we've played along with HHS and Secretary Becerra, along with the innovation from Moderna and Pfizer, what I would say is we're here to serve our communities. And during the pandemic, we were able to deliver over 88 million vaccines to keep our local communities safe during this time. And we're now available throughout the course of the back half of this year to continue to deliver more vaccines in our communities to keep patients and our families safe during this time. And then lastly, I just have a tremendous amount of gratitude, as Dr. Burla said, toward the scientists, toward our pharmacists, and toward all the caregivers that make this happen every single day in our local communities for all that they've done to keep our communities safe as well. So on behalf of CVS, thank you so much for doing this here, and we're really excited to be able to deliver the vaccine to you, Secretary Becerra, and to all of you that were able to join us. So thank you.
Dr. Khaldun.
Thank you so much, Prem. Thank you, Secretary Becerra. I'm really excited to be here today to really talk about access to these important vaccines. I'm a practicing emergency medicine physician as well, and all too often I see people coming into the emergency department with vaccine-preventable illnesses, things like flu, COVID, RSV. And unfortunately, some of those people are getting very, very sick, and even some people are really losing their lives. So this is really, really important. It's also important that we provide equitable access to these vaccines. And that's why things like the Bridge Access Program are so important. We're providing vaccines to people who don't have insurance, making sure that they can also protect themselves. And not just themselves, but also people in the community. People who may be older, people who may be very young, people who may have underlying medical conditions, making sure that not just that person who's getting that shot, but their family and their communities can also be safe. So this is just so important. I'm just so honored to be here today. I got my COVID and flu shots today as well, and really just commend everyone here today for really talking about equitable access to vaccines. And importantly, I'll also say, CVS Health has also provided 40% of their vaccines in 2022, their COVID vaccines, in underserved communities. That is really just so important and part of our commitment to advancing health equity.
Man of the hour, man of the moment. Take that swig, hurry up. David Brewster, Mr. David Brewster.
Wow. Hello, everyone. I'm David Brewster, and I'd like to thank the Secretary and Pfizer, Turner, and the doctor. And I'm here representing Community of Hope. And I'll be 70 2 more months. I've had all of my shots. I've had 2 Modernas, 2 Moderna boosters, and I had the Pfizer booster, and I had my shot here today. And I would like to say I haven't been sick. My wife hasn't been sick. We've taken all our flu shots. We stay up on our shots, and we do the stuff that they tell us to do. Wash our hands, wear our mask, all of that good stuff. And I'm just honored. Man of the hour, that's a big one. I'm just honored to be here. And we haven't gotten sick. We go around our families and everything. So I'd just like to thank you guys for doing what you do, and thank you very much.
Amen.
Thank you.
Questions?
And if you could please state
Cheryl.
your name and outlet, and the questions will be.
Cheryl, go right ahead. Yeah, speak nice and loud.
I'm Cheryl Day Stolberg from the New York Times. I have questions for the Secretary and also for Mr. Borland.
I think only I'm going to be taking questions. So
So, last year you restarted the COVIDtests.gov. Are you going to do that again this year? So, where are the tests coming from? And since Mr. Bonsell and Mr. Borla aren't speaking, I was going to ask, and you may know the answer, what is the price of these vaccines? What are the companies charging?
So let me, on the question of tests, and we're here because of vaccines, but it is important to test. And if you get sick, to get treatments. And what we want to say on tests is that just as before, the president wanted to make sure that no one would go without tests, we will once again up our program to make sure Americans have access to tests. Now, you can probably, even at this CVS, find COVID tests kits that you could purchase. But the president believes it's very important to make sure that all Americans have access to tests. And so we will once again begin our program to provide Americans with an opportunity to request tests. Stay tuned. We'll try to get that out as quickly as possible, but that is the plan moving forward. I will not try to speak for either Dr. Borla or Mr. Mansell. And stay tuned. They will give you information on pricing for their products.
Secretary?
Yes.
I'm Shen Yun with ABC News. How are you able to restart a testing program? What are the factors that go into shutting it down and starting it back up again? And do you think that has a confusing effect on people, whether it's happening or not happening at any given time?
So as I said, the COVID tests are available today. You could probably purchase one right here in this CVS. The president wants to make sure that no one is deterred from getting tests because of cost. And so we're going to up our program. Our plan is to up our program. The reason we can up the program is because our Department of Health and Human Services, through our Agency for Administration for Preparedness and Response, has been resupplying our stockpile. And so we will make available some of those tests that we have in our stockpile so that Americans can use them. We want them to be able to use those tests during this viral season, fall, winter, respiratory viral season. We want folks to get tested because that's as important as taking the other precautions. So we'll try to make those tests available. Stay tuned for the information on that.
Secretary.
Yes.
In the weeks since vaccine was cleared by the CDC, there have been anecdotal reports that people with insurance haven't been able to get their vaccines covered. Was there discussion with insurers about updating the benefits in time? Do you have an idea of when that might occur?
Yeah, just to repeat the question, there have been some reports, we've heard them as well, from people saying, hey, I've got insurance, but I went to go get my vaccine and I was told I had to pay. No, that's not correct. If you are told that you must pay and you are insured, then please make sure you're talking to your insurance company because you should be covered. By law, if you are insured, you are covered for COVID. If you are on Medicare, you are covered. If you are on Medicaid, you are covered. And if you don't have insurance, through this Bridge Access Program, you are covered. And so make sure that you know the facts. Talk to your insurance plan if they're looking to charge you. Talk to your pharmacist because sometimes they can clear up what's going on. We've heard these stories, and we've contacted the insurers, we've contacted the pharmacists, and we're working with them to make sure everyone understands how this works. You should not have to pay out of pocket if you are insured. So please make sure you're working with your insurance provider or perhaps the pharmacist. Or if you need to call us at Health and Human Services, and we'll try to make sure we get it all straightened out.
And if you can please state your name and outlet.
Yes, that helps.
Rachel with STAT. I've heard from researchers working on next generation vaccines that they've had trouble accessing samples of COVID-19 vaccines under kind of the government purchase regime. But now that we've transitioned, can you commit that researchers will be able to access these vaccines for research purposes now that it's transitioned to the commercial market?
So I don't want to commit to something that I'm not fully familiar with. I'm not sure exactly what the researchers are saying, but I don't think anyone doubts that we have to make sure that we provide the researchers with not just the tools, but the elements that make it possible for them to make the best discoveries as quickly as possible. And I'm sure that all those who have, the stakeholders who have access to some of those materials and so forth, we'll try to work with all those researchers. But stay tuned. We are in our, what we call our Next Gen program, doing everything we can, working with different companies to try to ensure that we are ready for whatever comes around the corner next after COVID. So that's what the Next Gen program is about. Stay tuned. Yeah. So this is a $1 billion+ program. As I said, you don't have to pay out of pocket for your vaccine, but it's not cost free. There are costs to making a vaccine available, but whether it's because you are insured and it's covered, or you are part of the Medicare or Medicaid program, or you are in Obamacare in the marketplace marketplace insurance plans, you will be able to get your vaccines, COVID and flu, covered. The Bridge Access Program was President Biden's way to make sure that no one in America, especially if you're under or uninsured, would not be able to get that vaccine. And I'm glad you've asked how it works, because we're here at a pharmacy. We are working with major chains, and actually some who are not major chain pharmacists, to make the vaccines available through the pharmacy. So this way, most Americans are just a 5-minute drive, pretty close by to a location where they can get their vaccine. But we're also making these vaccines available through your community health centers, because many people go to their community health centers for their health care. And of course, through your own provider. If you are insured, through your own provider. And if you talk to your county health officials, they'll probably tell you where they might make them available to you as well. So everyone should have access. Everyone should get vaccinated. And by the way, no one I think said this, but if it's been 2 months, 3 months since your last vaccine, you can get vaccinated, and it's worth your while to get vaccinated. 2 or 3 months out from your last vaccine or your last COVID infection. Let me go to somebody who hasn't asked a question.
Jay McMichael with CNN. We're also hearing that shots for children are taking longer to be available. Do you know why that is, and when can families expect to get their kids vaccinated?
So shots for children, the COVID vaccine is available to anyone 6 months of age or older. And so if it's available for your children as well. You may be talking about RSV or perhaps the flu, but the flu is also very much available. So we'd have to follow up with you. There is no reason why a child should not be able to get the COVID vaccine if adults are getting it. And we could check to follow up to see if there's some issues with the RSV vaccine. But the flu vaccine, I'm pretty sure, is available to kids as well.
And one follow-up, back to the insurance issue. Did the government give adequate information soon enough to the insurance companies for this rollout to happen? Do you think this confusion is going to affect the uptake?
We've been working with the insurers for months, with the pharmacists for months. We had to reach contracts with the various stakeholders. So everyone's known, but sometimes, whether it's a computer glitch or maybe something else, something could get in the way. My sense is that these are glitches that will be addressed pretty quickly, but if not, please know, first and foremost, you should not have to put money out of pocket to get the COVID vaccine. 2, if you are told that, then make sure you're getting some names, because we're all going to be trying to follow up. I'm sure CVS will do everything it can to make sure that it's following up, to make sure its pharmacists know how it works. And I'm sure that all those insurers that are making sure that their own members are safe are going to do what they can to make sure it's clear.
Well, as part of the Bridge program, the CDC is buying some vaccines for the health centers.
Yes.
How much is the CDC paying for those vaccines?
So I'd have to get back to you on that, because these arrangements were made quite some time ago with Pfizer and Moderna. but it will be similar to what we've paid in the past for the vaccines. And we are making those available to the community health centers and to some of the state and local health departments because some of them have clinics as well. Yeah, maybe one or two more questions.
Thank you, Secretary. I'm VSK from the Epoch Times. Why should people get the new vaccines given how little data is available to the public?
Actually, there's a lot of data available about the vaccines. There is a lot of data available about the effectiveness of the vaccines. But the best data, the best proof of their effectiveness is that we're all standing here alive because we've been vaccinated. You know, the best testimony comes from those who are standing. The best testimony against not being vaccinated can't come because those that aren't standing and have passed away can't say anything today. The vaccines have worked. They are saving lives. They're keeping people out of the hospital. And I think today we can all gather here and be fairly safe, even though we're not wearing masks again, because most of us have been vaccinated.
Is there a question from another outlet that hasn't had a chance?
Anyone else?
Great. I think that's all the time we have.
Okay, thanks all very much.
Thank you, guys. Thank you very much. Thank you very much. Thank you for everything you do.
Thank you very, very much.
You're welcome.
And you
Thank you
spoke
so much.
wonderful.
Thank you. I'll leave it
Good to see you, Albert, as always. It's great to see you. Thank you. Secretary, thank you for the invitation.
Thank you for coming.
Of course. No, very important. Very important. Well, I really like to know your story about my mom. Hey. Story with my wife. It's really make it personal.
Thank you.